all. I'm Dr. Neema Bhat, Senior Consultant Hematologist, Hemato-Oncologist, Bone Marrow Transplant Physician and Pediatric Oncologist. We are approaching May and I would like to talk to you about brain tumor because May is considered Brain Tumor Awareness Month. So what are brain tumors and what are some of the symptoms that you should be aware of and what should you know in general about brain tumors? So since I'm a pediatric oncologist, I will talk about the pediatric part and also a few general things that can apply to both pediatric and adult population. Brain tumors are nothing but cancers or tumors that arise from the brain. Brain tumors are one of the most common cancers in children. It is the most common cancer in children. The presenting symptoms in brain tumors can range anything from headache, of course, which can be very difficult for a young baby or child to express. Usually younger children who are not able to talk, we see symptoms like regression of milestones. So basically if a baby is able to sit or walk, they will no longer be able to sit or walk. They will lose control over their muscles, and that's because of the brain tumor. Babies can also present with vomiting, not able to tolerate the food that they take, loss of weight, sometimes blurry vision or loss of vision. The older children, it usually presents with, as I told, headache. If they're walking, then unsteady gait. So basically their gait will change and they're not able to walk in a balanced gait. Difficulty in being able to see the blackboard in school and unable to focus in school. Seizures or fits because of the presence of this mass in the brain. Mainly these are the symptoms. And also in older children it can present with severe headaches. Usually these headaches are early morning headaches. As soon as you wake up, they complain of headaches. And vomiting that does not come down with medications. Early morning vomiting. Loss of weight can also happen in older children. What is the incidence of brain tumors? As I said, this is the most common cancer in children. So accounts for most of the cancers in children. What are the different types? There are different types of brain tumors. Although everything arises in the brain, it can be in the front part of the brain, the middle part of the brain or the back part of the brain. And depending on where the location of the brain tumor is, the symptoms also vary along with that. As I described, most of these symptoms come along with brain tumors. In addition, there may be slurred speech. So basically children may not be able to talk after they've been able to talk normally, but they start having stuttering speech or slurry speech. They may have angle of mouth deviation, as in the mouth may not look normal and one side of the mouth may get deviated to one side. So any of these things that if you notice in your children, you have to make sure that they're evaluated by either their pediatrician or by a neurologist. And a basic scan that we get to look at if the child has a tumor is called an MRI of the brain. So MRI is nothing but, if you've heard of scan, X-ray, it is a detailed image of the brain and it gives us an idea whatever is going on. Is it a tumor? Is it some blood clot? Based on that, we pick up, what is the type of tumor or condition. Based on the brain tumor, the most frequently used treatment modality for brain tumors, whether it is in children or in adults, it is usually surgery. So whatever, depending on the location, whatever is possible is removed by surgical excision. So neurosurgeons are the ones who perform these elaborate, they are very, very highly specialized surgeries and usually require a long period of time. These surgeries are performed by neurosurgeons. In children's case, pediatric neurosurgeons. In adults, it is adult neurosurgeons. Following neurosurgery, there is a role for radiation in some patients. So again, depending on the location, sometimes entire mass can be removed. The entire tumor can be removed, and in that case, very little radiation is enough. But if the entire tumor is unable to be removed because it is there in a vital part of the body, in a vital part of the brain, where if you remove the tumor, it will cause a lot of damage to the brain. Whatever can be safely removed only is removed by the neurosurgeons, and the remaining tumor has to be melted by giving radiation therapy. There is also a role for chemotherapy in both pediatric and adult patients. Usually for pediatric patients, depending on the type of tumor, we usually give mild chemotherapy along with the radiation. And following the radiation is completed, we give chemotherapy, which is usually IV and goes on for a few more months. Brain tumors, depending on what type they are, there are a few low-grade brain tumors that have an excellent prognosis. It just is very important to recognize them, diagnose them at the right time, and make sure that the child undergoes neurosurgery or surgery at the hands of a skilled neurosurgeon, following which radiation therapy and chemotherapy, if required, need to be given. There are in fact some brain tumors called pilocytic astrocytoma. Depending on the location and the size, only surgery is required, and after that, no radiation, no chemotherapy is required. So this is in specific to pediatric. For adult patients, what applies is the symptoms. So a lot of symptoms are the same for adults as for pediatric patients, as in headache, vomiting, blurry vision, change in the gait, change in the way people walk, slurred speech, deviation of angle of mouth, sometimes severe weight loss. All of these can be the symptoms for adults also. The treatment modalities, the way we diagnose brain tumors is very similar between adults and pediatric. Adults also need to undergo a MRI of the brain and need to undergo surgery, radiation and chemotherapy. And the prognosis is better for pediatric brain tumors because they tolerate radiation and chemotherapy much better. They're able to bounce back from the surgery and chemotherapy and radiation much faster, and are able to lead good qualities of life post all these procedures as well. If you have any further doubts or questions, please feel free to reach out to me. I'm Dr. Neema Bhat. I'm a hematologist, hemato-oncologist and pediatric oncologist. Thank you.